wake up feeling hollow, my bones like brittle glass. Life's heavy burdens follow, but I won't let them pass. The weak can find their fire in every aching step, climbing a little higher in the void where dreams are kept. I'm not a shadow anymore, I'm finding muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow. My hands are shaking steady, sweat drips like melting ice. I've never felt so heavy, but I don't need to think twice. Fear feeds on fragile whispers, but I'll scream till it's worn out. Every scar turns it into blisters, I keep fighting, shed the doubt. I'm not a shadow anymore, I'm fighting muscles where I tore. I'll break free of my sorrow, gonna be stronger tomorrow.
Ever notice how just a few weeks of inactivity can leave you feeling surprisingly weak?
Yeah.
Like just climbing a flight of stairs suddenly feels like a marathon or something.
For sure.
That, my friend, is a sneak peek into the world of deconditioning syndrome.
And it's way more common than you might think.
Right.
Most people associate it with major events like surgery or hospitalization.
Okay.
But the truth is, deconditioning can really creep up on anyone who experiences prolonged periods of inactivity.
So deconditioning syndrome, it's not just about feeling a little out of shape.
No.
It's like a cascade of changes
It is.
that affect your muscles, your heart, even your metabolism.
Exactly. And understanding how it unfolds is key to recognizing the risks and taking steps to prevent it.
So let's unpack this, shall we?
Yeah, let's do it.
Our sources kind of break down deconditioning into 3 key areas:
Okay.
musculoskeletal, cardiovascular, and metabolic. Let's start with the muscles and bones.
Okay.
This is where it gets real, right? We're talking about losing strength and flexibility, things getting stiff, and even worse, contractures.
That's right. And the muscle loss happens much faster than you'd think.
Really?
Especially in those weight-bearing muscles we rely on for everyday movement.
Yeah.
Like in our legs.
Hold on, contractures.
Yeah.
That sounds pretty serious.
Yeah.
What exactly does that mean?
Imagine a rubber band that gets tighter and shorter.
Okay.
The less you use it.
Yeah.
That's essentially what happens to your muscles and tendons when they're not stretched and moved regularly.
Wow.
This can cause a joint to get stuck in a bent position, making it incredibly difficult.
Oh, wow.
Or even impossible to move.
Okay, now that's an image I won't soon forget.
Right.
So immobility is a major culprit here.
Yeah.
But what about our heart and blood vessels?
Sure.
This is the cardiovascular part of the equation, right?
Exactly. Deconditioning leads to what we call cardiovascular decompensation.
Okay.
Think of it this way.
Yep.
Your heart has to work harder to pump blood, and your blood vessels aren't as efficient at regulating blood flow.
Okay.
Simple actions like climbing stairs
Right.
or even just standing up
Yeah.
can suddenly feel exhausting.
I can definitely relate to that feeling of dizziness after being inactive for a while.
Right, and that dizziness can be a sign that your cardiovascular system isn't used to working against gravity.
Interesting.
In more serious cases, it can even lead to fainting.
Oh, wow.
Yeah.
Okay, so we've covered the muscles and the heart.
Right.
What about the metabolic effects of deconditioning?
This is a big one, and it's something that concerns a lot of people regardless of their age or activity level.
Right.
When you're inactive, your metabolism slows down.
Okay.
This means you're less efficient at processing sugar,
Uh-huh.
which can lead to insulin resistance.
Mm-hmm.
And you guessed it,
Weight gain.
weight gain.
You know how it seems harder to lose weight as we get older?
Yeah,
I feel like this is deconditioning just accelerating that process.
it is.
Like it just makes your body less efficient at using energy.
That's a great way to put it, and it highlights how even gradual reductions in activity over time can have a real impact on our metabolic health.
So far, we've covered how deconditioning affects our muscles, heart, and metabolism.
Yeah.
But you mentioned earlier that there's more to it, right?
There is.
What's happening in the brain
Yes.
during deconditioning?
That's a fantastic question, and it often gets overlooked.
Yeah.
Deconditioning has a real impact on our cognitive function.
Oh, really?
And mental well-being.
Wow.
Studies have shown that it can contribute to problems with memory, attention, and decision-making.
Really?
It can even increase the risk of delirium.
Wow.
Especially in older adults.
So it's not just feeling physically weak
No.
or tired.
Nope.
It can actually affect our ability to think clearly.
Precisely. And on top of that, prolonged inactivity can lead to feelings of isolation, frustration, and even depression.
This is definitely painting a much more complete and honestly a bit of a scary picture.
It is.
Of just how widespread the impact of deconditioning can be.
It's important to understand the full scope of the problem so that we can be proactive in addressing it.
Yeah, absolutely.
Yeah.
So we've seen how deconditioning unfolds and affects our bodies in some pretty alarming ways.
Yeah.
But the real concern is what happens if it's not addressed.
Right.
We're talking about some serious potential complications.
Absolutely. Deconditioning increases the risk of a whole range of health problems.
Right.
And these can be particularly dangerous for people who are already vulnerable due to age, illness, or injury.
Okay, so let's dive into those complications. I know this might sound a bit heavy, but as you said, knowledge is power. The more we understand the risks, the better equipped we'll be to prevent them.
Exactly. So one of the most common complications of immobility is the development of pressure ulcers.
Pressure ulcers?
You might have heard them called bed sores.
Oh, yeah. Bed sores. Those sound painful.
They are.
What exactly causes them?
Pressure ulcers form when there's prolonged pressure on the skin, usually over bony areas like the tailbone, heels, or elbows.
I see.
Imagine someone who's been lying in bed for an extended period.
Yeah.
The constant pressure cuts off blood flow to the skin.
Wow.
Which can eventually lead to tissue damage and the formation of an ulcer.
Okay, that's a vivid image and not a pleasant one.
No, it's not.
And it's not just pressure ulcers we need to worry about, right?
No.
There's also the risk of blood clots. Or venous thromboembolism, as it's medically known.
That's right. When you're inactive, your blood flow slows down.
Okay.
And this increases the risk of clots forming, especially in the legs.
Yeah.
These clots can be extremely dangerous because they can break loose.
Oh, wow.
And travel to the lungs, causing a pulmonary embolism.
So immobility is a common risk factor for both pressure ulcers and blood clots. And these can affect anyone who's experiencing prolonged inactivity.
Right.
Not just those who are hospitalized.
Absolutely. That's why it's crucial to understand the importance of movement, even if it's just small, frequent movements throughout the day.
Right.
Getting up to walk around, doing some simple stretches.
Okay.
Or even just changing positions in bed can make a big difference in preventing these complications.
So we've covered pressure ulcers and blood clots.
Yep.
What about those pulmonary complications you mentioned?
Sure.
Like pneumonia?
Right. When you're not moving around much, your lungs don't expand as fully.
Okay.
And this can make it harder to clear mucus and secretions, creating a breeding ground for bacteria.
So someone who's already weak and immobile is more likely to get pneumonia because their lungs aren't functioning optimally.
Exactly. And this is especially concerning for people recovering from surgery or illness, as their immune systems might already be compromised.
Makes sense.
That's why early mobilization is so crucial. It helps keep the lungs clear.
Yeah. And reduces the risk of these pulmonary complications.
Okay, deep breaths, everyone. We've covered a lot of heavy information about the potential complications of deconditioning.
Right.
But now let's shift gears and talk about the good news.
Okay.
The fact that many of these complications are preventable.
Yes.
With the right strategies.
Absolutely. And this is where it gets empowering.
Yeah.
By understanding the risks and taking proactive steps, we can significantly reduce the likelihood of these complications developing.
Okay, so let's talk about prevention.
Okay.
What are some of the key things we can do to mitigate these risks?
Well, I can't emphasize enough the importance of early mobilization.
So getting people moving as soon as possible, even if they're still recovering from an illness or injury.
Exactly.
Yeah.
Even small movements can make a huge difference.
Yeah.
It's not about running a marathon on day one. It's about gradually increasing activity as tolerated.
So think baby steps, not giant leaps.
Right.
What kind of movements are we talking about? It can be as simple as range of motion exercises, where you're gently moving your joints through their full range of motion.
I see.
Or short walks around the house, or even just standing up and sitting down a few times.
Okay, so early mobilization is key. What else can we do to prevent these complications?
Nutrition plays a crucial role in preventing and managing deconditioning.
So making sure we're getting enough of the right nutrients, especially protein.
Exactly. Adequate protein intake is essential for maintaining muscle mass and supporting overall healing.
Yeah.
A registered dietitian can help develop a personalized meal plan that meets individual needs, especially for those recovering from surgery or illness.
That makes sense. So we've got early mobilization and proper nutrition. What other tools are in our arsenal for preventing these complications?
Assistive devices can be incredibly helpful in preventing complications and supporting recovery.
Okay, what kind of devices are we talking about?
Think of things like pressure-relieving mattresses. For those who are bedridden, specialized wheelchair cushions to prevent pressure sores or walkers to help with mobility, these devices can make a world of difference in promoting comfort, safety, and independence.
So it's about finding the right tools to support movement and reduce those pressure points.
Yeah.
What about medication? Does that play a role in preventing complications?
Yes. In certain cases, medications might be prescribed to address specific issues related to deconditioning.
Okay.
For example, pain medication can help manage discomfort and encourage movement, while anticoagulants might be prescribed to prevent blood clots.
So it sounds like there's a whole team of people involved in preventing and managing deconditioning.
There is.
And speaking of teams, that leads us perfectly into our next section,
Okay.
which is all about building your deconditioning dream team.
Right.
Because you're not in this alone.
You are not.
It takes a village, right?
It does.
Or in this case, a dream team of healthcare professionals
Yeah.
to tackle deconditioning head on.
That's a great analogy. And just like any successful team,
Right.
each member brings their own unique skills and expertise to the table.
Okay, so let's introduce our all-star lineup.
All right.
We've got physical therapists, occupational therapists, nurses, and of course the medical team overseeing everything.
Right.
Let's start with physical therapy.
Okay.
What's their role in all of this?
Physical therapists are the movement specialists.
Okay.
They're the ones who assess your strength, flexibility, and balance, and then design a personalized exercise program to help you regain function and prevent further decline.
So they're like the coaches guiding you through the recovery process.
Exactly.
And cheering you on every step of the way.
Yeah, they'll teach you the proper techniques for exercising safely and effectively.
Okay.
And they'll help you gradually increase your activity level as you get stronger.
That makes sense.
Sure.
Now, what about occupational therapy?
Sure.
How do they fit into the picture?
Occupational therapists focus on helping you regain independence in your daily activities. Okay.
Think of things like dressing, bathing, cooking.
Yeah.
Or even just getting around your home safely.
So they're the ones who bridge the gap between therapy and real life.
Yeah.
Making sure you can actually function in your everyday environment.
Exactly. They might recommend adaptive equipment to make tasks easier.
Oh, okay.
Like grab bars in the bathroom or special utensils for eating.
Right.
They can also teach you new techniques for doing things that might be challenging due to deconditioning.
That's incredibly helpful. So we've got our movement specialists, our everyday living gurus, and of course we can't forget about nurses.
Right.
What's their role in preventing and managing deconditioning?
Nurses are the vigilant protectors.
Okay.
The ones who are constantly monitoring your condition and looking out for potential problems.
Yeah.
They play a crucial role in preventing complications like pressure ulcers.
Right.
Making sure you're staying hydrated and helping you move around safely.
So they're like the eyes and ears of the team, always on the lookout for any signs of trouble. Precisely. They're also there to provide support and encouragement, answering your questions and helping you stay motivated throughout the recovery process.
And then we have the medical team, the doctors and nurses who are managing the underlying medical condition.
Right.
And prescribing any necessary medications.
The medical team plays a critical role in addressing any underlying health issues that might be contributing to deconditioning, like pain, inflammation, or heart problems.
Okay.
They work closely with the other members of the team to ensure a coordinated and comprehensive approach to your care.
Okay, so we've got a whole team of experts working together to address deconditioning from all angles. It's pretty reassuring.
It is. And remember, you're the most important member of this team. Yeah. Your active participation and commitment to the recovery plan are crucial to success.
Okay, so we've covered a lot of ground today, from understanding what deconditioning is and how it affects us, to exploring the potential complications and the importance of prevention and early intervention.
Yeah.
What are the key takeaways you want our listeners to remember?
Well, first and foremost, deconditioning is a serious issue that can have a profound impact on your physical health, mental well-being, and overall quality of life.
Yeah, it's a big deal.
It is. But the good news is that it's often preventable and treatable.
Right.
Especially when addressed early on.
And it's not something you have to face alone. Building a team of experts can provide the support and guidance.
It can.
You need to regain your strength, independence, and confidence.
Absolutely. If you're concerned about deconditioning, whether for yourself or a loved one, don't hesitate to reach out for help.
Where's a good place to start? Who should people contact?
Reaching out to your home health physical therapy provider is an excellent first step.
Okay.
They can assess your individual needs and connect you with the right resources and professionals.
That's a great tip. Having that personalized support and guidance can make all the difference in the world.
It can.
All right, folks, that wraps up our deep dive into deconditioning syndrome. We hope you found this episode informative and empowering.
We do.
Remember, knowledge is power, and taking proactive steps towards your health is the best investment you can make. Thanks for tuning in, and we'll catch you on our next deep dive.